Yes, as you know, HIV is a pandemic, and Malawi has been hardly hit. We are talking about 12% of the population now HIV positive. And it's not just the figures, it's people behind those figures. A lot of people, a lot of orphans that are left behind, a lot of suffering in the country because of HIV and AIDS. And obviously as a church, we are concerned about this situation, and we have always been concerned about this situation. Right from way back in the 90s, early 90s, the church began to look at this as a pastoral issue, to provide care, support, mostly for the people that are suffering, because in those days there was very little hope really for people who were HIV positive. You know, they will be dying in months or in years, and what was critical is provide them with hope, with support. And that's why from the 90s we have had in the country a very strong conviction that we need to support these people, and we formed what are called home-based care services, HBC services in all the dioceses, where we would provide spiritual support, provide material support, provide human support for those directly involved and also for the larger family. Yes, the face of HIV/AIDS has changed since those early days. Obviously, there are ethical questions that we need to address, and as a church, we should address the issues of human rights that we need to address these days. It's clear that HIV/AIDS is not just a disease like another disease. It's a social problem as well amongst us. So as a church, starting from the home-based care experience that we have and we have had, we are going further than that, or we are enlarging our scope and looking at the factors that fuel the spread of HIV, the poverty situation in the country. So in our development programs in the country, led by the Catholic Development Commission, we target vulnerable masses, and we make sure that in our development programs also HIV/AIDS is a major component in targeting the beneficiaries, but also in making sure that our development programs are sensitive towards those that are suffering, and that our development programs do not fuel the spread of HIV/AIDS. That's what we do. In terms of advocacy also, we are trying through the Catholic Commission for Justice and Peace to look at also issues that are fueling HIV/AIDS, the spread of HIV/AIDS from a human rights perspective. What is it that people who are HIV positive are suffering in terms of rights, so access to services. We have like Action for Better Service Delivery, Action, that is a program that really makes sure that those that serve the communities, like the government and various players, do not become selective, that everybody receives these services regardless of their status, and that services that are promised for various areas are tracked down, and make sure that these are done, and also to sensitize the communities on the ground that essential services are given. But we're also looking at issues of gender. Gender is a major issue in HIV/AIDS. Oftentimes, women, girls are at a disadvantage in our communities, because oftentimes they are weaker in terms of economic muscle and also voice. So as a church, we are targeting those in our community, women and girls, to empower them through education. But also of late, we have a program through the Catholic Commission of Justice and Peace, which is targeting now men to sort of change their mindset. We have what we call men-to-men programs, men-to-men programs, what we call in our local language, as Bambuachi Sanzos. These are men who are exemplary, so that they can begin to talk about these issues within their own setting, when they are talking, when they are amongst themselves. We say, what is it that we are doing? We have a men-to-men kind of apostolate where fellow men are beginning to tackle these problems, and they are beginning to say, no, to be a man, you don't have to perhaps pressurize women or begin to think that to be a man means that you are better than a woman. There is also a program that we have embarked on that looks at risky behavior of men, because we think men think they are superior. Then they'll go and prove themselves, prove their manhood, maybe even through sexual contacts. That as many women that you bed as possible, the number of women that you bed or the number of women relationships that you have has a direct linkage to yourself. You're feeling good as a man, to break that linkage. That's one other program that the church is involved in. When you talk about prevention, particularly prevention of the transmission, I think various players have said, and perhaps rightly so, that the church has been very good at addressing issues after somebody is already HIV positive. But what is it that we're doing in preventive measures? And I know we're doing quite a lot, like in our clinics, prevention of mother-to-child transmission, educating people so that they are faithful, yes. But oftentimes we are faulted on the methods that we're using, that some of the methods are found to be hard for youngsters, for people who are in real life, trying to survive, that if you tell them to abstain, fine in an ideal situation, but what about those who cannot abstain? What about those who would like to continue with their married life? What about in situations where you have one who is HIV positive and the other one who is HIV negative? What is that the church is offering? And I think there has been silence in that area. I know that as a church, we are looking, certainly in Malawi, we are looking at having some kind of guidelines in these areas. I know the bishops will be meeting next month to talk about these issues and other also ethical issues surrounding HIV/AIDS, but also surrounding issues of sexual and reproductive health, so that we provide clarity, because I think clarity is lacking, and I think that can be a first step towards containing the pandemic. We don't want to go on the ground and send conflicting messages to people who want some kind of clarity. And I think already the ingredients of that clarity within the church itself, respect for life, respect for our sexuality, appeal to conscience, to the conscience of the people, forming the conscience of the people, so that in a difficult situation, in a crisis situation like this one, this is not an ordinary situation, that the conscience of people is formed in such a way that right decisions are made, decisions that will protect life are made. In a situation, I repeat, that is not ideal, in a situation that is difficult situation, in a pandemic situation, in a situation of emergency. It's not something that you can wait for another 2 years or for another 5 years. You're dealing with lives that are being lost. We're dealing with people that are struggling to find a means to survive. You're dealing with an area that is supposed to give life, sexuality, that is also transmitting death at the same time. I think those are parameters that, as a church, obviously, we would like to look at, so that clearly we provide the right framework for action from an ethical perspective, and also that we provide training, particularly for our people, so that together we can look at this pandemic as indeed a challenge that is before us, as sons and daughters of God, a challenge that with our faith we can conquer, I think.